Hey guys, so we are 2 weeks post-op. Yesterday was officially 2 weeks, but I waited till today to do the video because I went back and saw my surgeon this morning to get my stitches out and for him to just look at everything. They actually let my 10-year-old brother take the stitches out. So for those of you that are scared about getting the stitches out, it's easy. It doesn't hurt. But yeah, he was super happy with how everything looked, and he went back over the surgery with me, just kind of explained like everything that he did. But yeah, super happy with the outcome of it. He said it was the best case scenario, if that's possible. Then this afternoon, I went for my first PT appointment for this go-around of the surgery. I'm with the same physical therapist as I was with the last time, which has helped a lot for me. The first couple weeks of physical therapy were very hard for me and very scary. So I struggled through those a lot because I was too guarded and tense, and I just wasn't able to relax and let her kind of like do what she needed to do. This time, obviously, being more comfortable with her and more comfortable with just the surgery itself, I wasn't nearly as guarded, nearly as tense, so she was super happy with my movement and said I was moving great for only 2 weeks. For those of you about to get the surgery or like curious about the first couple weeks of PT, like how do you do PT in a sling, I don't know if I mentioned in the previous videos, so like at home for the first couple weeks, they'll have you doing pendulums, which is basically like leaning on a couch and you just let your arm hang and you swing your body so it moves your arm for you, and that just kind of like gets like the ball and socket moving a little bit. Once you go to physical therapy, your therapist will just have you like lay down. You'll be completely relaxed. You can't really tense up or else it defeats the purpose. But you're completely relaxed, and they just kind of like move your arm a little bit. They try to like get you out to the side as much as possible, get you like up and just moving around as much as you can so you don't get like that frozen shoulder, which some people can get if they don't start moving it. But yeah, pretty much when you're in the sling for the first 6 weeks, nothing super crazy or exciting or hard really happens at physical therapy. It's pretty boring. It's mainly just them moving it for you. But yeah, it's nothing super exciting, but if it's something that you've never done before, you do kind of like guard yourself. It is kind of nerve-wracking, but they know what they're doing. Big things that happen at the 2-week mark, you get cleared to do like a stationary bike, which doesn't sound super exciting, but if you haven't really moved in 2 weeks, it's pretty exciting to finally be able to exercise and feel like you're moving, breaking a little sweat. They tell you can start like driving more, which is pretty exciting, especially since I've been stuck in the house for 2 weeks. Yeah, nothing too crazy. You can start like if you're home and you're not doing anything, you can start walking around and like being without the sling, as long as you don't move your arm around like crazy, which especially in the summer when it's hot is very nice. You get to air out your arm and air out the sling. But yeah, other than that, nothing too crazy. It's been a pretty boring 2 weeks. I'm hoping the next couple weeks, now that I can start doing more, it'll be a little more exciting and I won't be stuck in this bed so much. But yeah, good day. Great news from both my doctors, so I'm feeling good, and I'll be back on next week.